Welcome to Southampton Safeguarding Adults Board Safeguarding Adults Awareness Week presentation. We thought it would be a good idea to enable staff and members of the public alike to learn more about our efforts at the Safeguarding Adults Board. So basically, I'd like to introduce myself. So I'm Deborah Stuart-Angus, and I'm the independent chair for Southampton. And I've been in that situation for about two and a half years. And I've put together a presentation today to try and increase our understanding of the role of the Safeguarding Adults Board, what we do, how we do it, and why. So I hope you find it useful. And here goes. So the first question I've probably put forward on your behalf is, what is the purpose of our board? Why do we have it? The reason we have it is because it's a statutory requirement to have a Safeguarding Adults Board, which I'll go into more a bit later on. But in short, at this point in the presentation, it's important for me to say what we must do. So we must seek assurance that the local safeguarding adult arrangements are in place. That means working with agencies, the NHS, the police, statutory authorities, voluntary agencies, housing, all different kinds of people that are involved in working with people that may have care and support needs. We must prevent abuse and neglect wherever we can. And we have to provide timely and proportionate responses in relation to the fact if we know abuse or neglect has taken place. We have to lead our adult safeguarding across the partnership for Southampton and oversee the effectiveness of safeguarding work and activities of our membership. And we also have to concern ourselves with the prevention of issues to do with abuse. So, for example, patient safety, quality of local care and support services, the effectiveness of safeguarding in prisons, probation services and modern slavery, as just by some example. The next question I've raised is about our structure. Our structure is designed deliberately so that we can deliver what we need to deliver. And when you may look at the presentation for this particular talk today, you'll see that our structure has the main board, if you like, at the top, and that is driven by an executive team. The executive team is made up of myself, the police, the NHS, and adult social care, with support, of course, from the partnerships team in Southampton City Council, where my board manager works really hard to enable us to reach our goals. We're connected to the Joint Safeguarding Business Partnership, and we also have several groups who are basically our delivery arms. Our delivery arms for the board are our Learning and Development Group, our Quality Group, our Prevention Group, our Case Review Group, and the Southampton Modern Slavery Steering Group. A lot to take in at once, so I'm not going to spend too much time on structure because I think it's more important to figure out what we do and why we do it. So you might ask yourself, what lawful duties do we have? In fact, our lawful duties fall into 4 categories. Under the Care Act, it says that a local authority, in this case Southampton City Council, must establish a board for safeguarding for the area to help protect adults with care and support needs. You may be familiar with section 42(1), and that's where that particular provision is set down. The board, as a consequence of section 42(1), must coordinate and ensure effectiveness of safeguarding activity of its members, and all of its partners must deploy and manage their own statutory safeguarding responsibilities. In relation to the third duty, a SSAB may do anything which appears necessary or desirable for the purpose of achieving its objective in relation to safeguarding an adult with care and support needs. And that Schedule 2, which includes Section 42, Section 43, Section 44 and Section 45, has effect in relation to this about provision for membership, funding, resources, strategy, annual reporting, the shared duty to cooperate, information sharing and carrying out safeguarding inquiries. Hence why we hear quite a lot about Section 42 inquiries, and that's the schedule where that duty sits. So that's the overarching, if you like, legal obligations that we have. Set within that, we have core duties. Those core duties for the board are 3 levels. We have to develop and publish a strategic plan. This is a partnership level plan, and it sets out how we will meet our strategic objectives and the expectations we will place on partners for their contributions. This is done in consultation and collaboration with our partnership, and I have to say in Southampton we have an exceedingly strong Safeguarding Adult partnership. We must publish an annual report where we detail how effective our activity has been across the partnership for safeguarding as a whole. And we have to share that annual report with various chief executives, local authorities, and anybody that wants to see it. It's also available for public inspection. We also must arrange something, as you may have heard, called a Safeguarding Adult Review, commonly known as a SSAB. We have to do this for any case which meets the lawful criteria, or any case where Southampton Safeguarding Adults Board believes that learning can be gained from how agencies worked together, or not, as the case may be. So in relation to our legal obligation to conduct a Safeguarding Adult Review, you might ask yourself, well, when does this kick in? And I can share that with you. So under section 44, we have to arrange for a review of a case involving an adult in Southampton who has care and support needs, whether or not the City Council has or is meeting any of those needs under certain conditions. The first condition is if there's reasonable cause for concern about how our members of our board, or others indeed, with relevant safeguarding functions, worked together to safeguard that person. And as well, if one or two of the following criteria or conditions are met. Those conditions are, number 1, that an adult has sadly died and that the board knows or suspects that the death resulted from abuse or neglect, whether or not we knew about that or suspected it before the death. And secondly, when the adult is alive and the board knows or suspects that they have experienced serious abuse or neglect. However, we can also arrange for a SSAB to take place for any person in our area, whether or not their needs are being met or have been considered, if we think abuse or neglect has taken place and agencies could have worked better to have prevented it. Also under section 45 of the Act, all SSAB members, i.e. Safeguarding Adult Board partners, must cooperate and contribute to carrying out a SSAB in order to identify lessons to be learned and apply those lessons within their organisations if they're affected in the future. This is known as the section 45 rule. You may ask yourself, what's the purpose of a SSAB? You hear probably about them a lot. Insofar as it might be easy for me to put this into what we must do and what we must not do in relation to this particular description. So a SSAB must be relevant for learning lessons, for improving practice, for improving services and adjustments to be made. A SSAB must identify those lessons to be learned between agencies and within agencies, and how and in what timescale those lessons will be acted upon. A SSAB must identify what will be different as a result for practice to improve. And a SSAB must review the effectiveness of policy and procedures in relation to the multi-agency and organisation policy and procedure that we have in Southampton City. What a SSAB must not do is act as an investigation, and it must not apportion blame. It definitely should not act as judge and jury, and it must not use hindsight bias. What it ultimately should try and achieve is to improve intra and inter-agency working to better safeguard adults at risk. At the moment in Southampton, we have about 16 SSABs in progress, and we have a case review group who work exceedingly hard to manage these processes and enable and assist families who are going through some difficulties, obviously, that SSABs can bring to families in relation to previous anxieties and having to deal with death. The Case Review Group in Southampton provides a professional forum to review all the referrals that come through the door, particularly where an adult has died unexpectedly, suffered significant harm, and for whom this has been led to a serious consequence. The case review group also makes recommendations to myself with regard to either taking a referral forward or not, as the case may be, either as a formal SAR or sometimes in a different format of a different type of review. For example, a domestic homicide review, a child practice review, or a single agency review, possibly advising the NHS in relation to serious incidents and root cause analyses. So there are various methodologies that we can use if we think it's relevant. In relation to setting out clear guidance on our governance, we have put together in Southampton a quality assurance framework for SARs. We have a clear methodology and commissioning processes for independent reviewers. All reviewers who are appointed are independent, and that's obviously for a set of strong reasons, because people need to be independent from the organisations that are concerned if they are reviewing their particular organisation's practice and service. The case review group also manages, monitors and considers very seriously the evidence base of all agency action plans and the outcomes. So what that means in reality is that the case review group actually ensure that improvement action plans from SARs are delivered by an evidence base that is supplied from the agencies affected. In relation to our strategy for safeguarding across Southampton City, we've set 3 priorities, and we set these 3 priorities a couple of years ago. So by next year, we'll be starting to look at this again. The priorities we set were prevention, quality, and learning, with the associated safeguarding delivery objectives, business plans, key deliverables, and a RAG-rated work plan, which basically means a work plan that we keep up to date with what we've achieved and what needs to be achieved and what we would like to achieve. Deliverables clearly formulate each subgroup's delivery plan, and the monitoring of these deliverables is met by the aforementioned executive group when I referred to the structure. We also have a legal obligation to make an annual report. And you might ask, well, what do we report on? So we report on our duties, whether we've met them, our legal duties that I've mentioned. We report on our safeguarding data. We report on our partner contributions, which in Southampton are considerable and significant. And we report against whether we've met the deliverables within the 2021-2024 strategy that I've just mentioned. We also report against the outcomes of the delivery plan, and we also have a legal obligation to report on the SARs that have been published in that reporting year. We have also to work obviously very closely with the recommendations from SARs. And for the purpose of just giving you some idea of how this affects practice, these are some of the general themes that we have seen over the last 2 years in relation to outcomes from safeguarding adult reviews, where there has either been a death or serious concern about abuse. We've seen the need to improve the application of the Mental Capacity Act 2005 in practice, and that's across the piece. It's for social work, nursing, general practice, commissioning, a whole array of different places and areas where this does need to be considered and improved. We need to increase our professional curiosity. Sadly, we've had too many cases where professional curiosity has not gone down the pathway it needed to, and people perhaps didn't ask the right questions at the right time, and consequently neglect has been the outcome of that particular issue. We need to raise safeguarding concerns in a timely way. Again, we've had examples where safeguarding concerns haven't been raised, or they haven't been raised for several months or weeks, and this also obviously can affect in relation to intervention in a case. We need to get better at multi-agency working and sharing information. In the 22nd century, whatever we're in at the moment, you wouldn't think that would be an issue, but it is. So really, it's about having the right structures in place to make that happen and to enable practitioners to be able to make that happen. We also need to focus more on risk management, holistic risk management. That's getting together and sharing the risks that we see in cases and trying to prevent abuse and neglect at all levels. We need to improve our engagement with self-neglect cases particularly, and I know this can be very difficult. And we also need to be aware of our self-neglect policy and procedure. We need to get better at working with families. and not see people in different sort of boxes or silos. We need to use the think family approach, as is used quite a lot in children's services, and we need to be thinking like that too in adult services, and we need to improve some of our commissioning processes. In relation to the influence on practice, I can give you some local and national guidance examples of where there has been a huge impact on practice improvement as a result of SAR outcomes. So some of those examples are, for example, you may be familiar with the word MARM, so the Multi-Agency Risk Management Framework. A lot of work from SARS has influenced different MARMs in different areas, particularly in relation to Southampton. The influence on practice can be seen in using the family approach. It can also be seen in various guidance that the SSAB puts out. So we've developed the hoarding guidance. We've worked with children's and developed the transitions framework. The safeguarding concerns framework that came out nationally, obviously that was based on a lot of research, particularly not least the national research done on SARS. And we need to review and improve patient observation. So we've seen policies that have been affected by SARS in relation to improvements there. Supervision frameworks, we've seen improvements in those. Training, obviously, we provide training where we can, and we encourage training where we can, particularly in relation to the holistic learning development that would come from a SAR and its impact on a particular organisation. National level, we've seen specialist commissioning improvements in mental health services, although there's still a long way to go, and ultimately the influence on research. So as you can see, SARS have a big impact in relation to the national changes that we see on probably quite a regular basis. Ultimately, that is my quick run around of the duties and the obligations and the purpose of the Safeguarding Adults Board. And I hope in some ways it's given you a useful insight into the responsibilities and the achievements that we've made. We are going to attach with this access to this presentation, and please go on our website where you can access all of our learning briefings in relation to our Safeguarding Adult reviews. I have to say, working for Southampton, we've built on our statutory duties. We've been on a journey. We're passionate, we're dedicated, we're a very committed partnership, and we continuously work to keep the most vulnerable people in our city free from harm, abuse and/or neglect. And I thank you personally, as the chair of this board, for taking an interest in our work. Thank you. Goodbye.